I don't have a choice whether or not I have Parkinson's, but surrounding that non-choice is a million other choices I can make. Hello everyone and welcome to CliWare Presents Therapeutic Module presentation on Parkinson's disease. This is Nashin Toes, research intern, CliMed Research Solutions, and I'm going to help you understand the basics of Parkinsonism, signifying today's event of World's Parkinson's Day 2021. So what do we mean by Parkinsonism? In basic terms, Parkinson's is a brain abnormality that majorly affects a region in brain called primary motor cortex, which handles motor system that includes all the different day life output activities like running, walking, swimming, facial expressions, or even the emotions. What are the different risk factors or the causes which can result in the development of Parkinson's disease? Firstly, the most important factor and the common reason which lies in majority of the Parkinson's cases is advancing age. So even if the person is not having any of the other coexisting diseases, if he is getting older, especially after the age of 60 years, then he is equally susceptible to the development of Parkinson's disease. And secondly, smoking. The smoke consists of hazardous chemicals or pollutants which once gets accumulated in the body can result in the degeneration of the neurons and result in the abnormal brain activity. And as you all know, in almost all diseases, genetic factors play a very important and a strong role for the development of the disease, which can also come from your family. And then the head trauma. Many of the physical accidents, many of the head accidents can result in the physical damage of the brain, which can result in the abnormal degeneration of the neurons and hence abnormal activity. People who are working in industries or factories, when gets exposed to the chemicals, then these hazardous chemicals or pollutants gets accumulated in the body abnormally, and hence it results in the formation of free radicals, which is highly toxic for the functioning of the neurons in brain. What is pathophysiology? What is the exact brief mechanism which lies behind Parkinson's? So if you just see the structure of the brain among all the parts and regions and subregions of brain, the two main parts of the brain, what we have to focus in Parkinson's disease is cerebral cortex and basal ganglia, which forms a very important link between them. So as you can see, the cerebral cortex decides many of the body movements, and the basal ganglia consist of millions of nerves in bodies which are responsible for the implementation or the execution of smooth movements. So the link between them is that the cortex will be only deciding the movement, only a thought will be processed in cortex, which will be sent to basal ganglia through the neuronal connections, and then that particular thought will be perceived by basal ganglia, which will then execute or implement those smooth movements practically. Now, if you just look in detail about basal ganglia, it majorly consists of two regions: the striatum, which constitutes caudate nucleus and putamen, and the substantia nigra. And these two regions are connected by a pathway called dopamine pathway. Now, it is called a dopamine pathway because this particular pathway consists of many of the neurons which releases a chemical called dopamine, which is also called a neurotransmitter. Hence, it is called a dopamine pathway, which consists of many of the dopaminergic neurons, resulting in the release of dopamine. So if you look closely about these dopamine producing neurons, then they are strongly interconnected with each other through dendrites or the axon terminals. So if you just look at the basic structure of the neuron, it majorly consists of axon terminals at the end. And hence, the axon terminals of neurons connect with each other and form a junction between them called synapse. Now, if you look in detail about this synaptic junction, then the presynaptic neuron releases many of the neurotransmitters, that is dopamine, which bind with the receptor of postsynaptic neuron and hence generates an electric signal that passes through the motor dopaminergic neuron. This is the motor dopaminergic neuron through which the electric signal passes and results in muscle contraction. This is the normal physiology in healthy patients, where the dopamine will bind with the dopaminergic receptors, and this results in the normal physical activity. Whereas in Parkinson's patients, because of the degeneration of dopaminergic neurons, the dopamine deficiency results in abnormal or the restricted body movements. So now what do they present with? When we look at these patients, what do we observe, like the different signs and symptoms on what we have to note on? So firstly, the tremors, which is the most important and the common symptom of the majority of the cases, which means that involuntary shaking or movements. So by involuntary means we mean that the patient, even if the patient is not thinking, not deciding to make a movement or to initiate a physical activity, automatically that movement will be initiated, which majorly affects the physical features, mostly like hands, legs, face, head, or even the vocal cords. So now you can understand that this disease can also affect your speech. It can also interrupt with your speaking ability. So now coming to dysphagia, where there is difficulty in swallowing foods or liquids, which can also result in poor appetite of the patient. Now coming to postural instability, where the patient will not be able to maintain the normal body positions. So whatever the position a patient is maintaining in that particular thing, he'll not be able to maintain normal balance. Hence, he needs a physical assistance to handle his position. And then coming to abnormal gait. So basically, gait is a normal walking pattern where it will be completely become unstable in the Parkinson's patients, where it will result in the abnormality in walking, and hence the patients will be unable to walk in a usual way. Rigid muscles and right changes. So because of the rigid muscle contractions or the restricted muscle contractions, it results in rigid muscles where the muscle stiffening takes place, and it will be very hard to move a muscle or to move bone or do any normal physical activity. And it also affects the smaller muscle contractions as well, which can result in the abnormal handwriting. Mask-like face. So here the cartoon-like face will be appearing, which will be completely different from before the disease. It is also characterized with different features like hypomania, where there is reduced facial expressions, there is reduced eye blinking, and there is pulling of saliva. So even if the saliva is secreted normally in mouth, it will be leaking out of the mouth. Parted lips, where there is a gap between two lips, and hence there will be difficulty in speech again. Coming to dystonia versus dyskinesia. So these two are the basic mechanisms which lie behind the different features or the symptoms what we have seen before, like tremors or abnormal postures, etc. Dystonia is nothing but abnormal muscle tone. So what do we mean by muscle tone? It is basically a pattern of alternating muscle contraction and relaxation, which will be completely unstable, resulting in muscle spasms and abnormal posture. And dyskinesia, where there is abnormality in voluntary movements, where even if the patient is deciding to make a movement or to do physical activity, then he will be unable to. So as you can see here, the common muscle groups which is getting affected by dystonia is face, neck, eyes, vocal cords, torso, limbs, and foot. Whereas in dyskinesia, the muscle groups affected are head, arms, trunk, and legs. Now the other symptoms what we can observe are nightmares, sleep disturbances, restless sleep. There will be complete poor quality of sleep in these patients. And psychologically, they will be having a memory loss, confusion in the evening hours, and will not be able to perceive the things in a normal way, where they will be having some thoughts, unusual thoughts, which are actually not existing in the social surroundings. They will be having a distortion in sense of smell. They will be not having any control on the maturation process, where the leaking of urine takes place because of abnormal muscle contractions. And as the disease also affects the voice box, so because of the voice box, that is larynx spasm, it results in the difficulty in speech or speaking. And the other symptoms can be constipation, the patient will be depressed, there will be a neck tightness similar to muscle rigidity, there will be weight loss, unintentional breathing, there will be loss in contrast sensitivity, visuals will not be stable and will not be normal, the fear of falling, as the patient will be having the knowledge of abnormal muscle contraction and the loss of activity, he will be always suffering with the fear of falling, that he may fall if any of the activity will not result. So these are different symptoms. Now coming to stages of Parkinson's. So now to what extent the Parkinson's can spread to? What is the severity of the Parkinson's disease? So that can be these 5 stages which can describe this thing. So in first stage, only one side of the body is affected. In the second stage, both sides will be affected, but the balance remains stable. And as we go in the higher stage, there will be impaired balance, but the physical functions will be completely stable. And in the higher stage, in fourth stage, the balance as well as the physical functions will be completely lost, but still the patient can do his normal activities without any help. But in the most higher stage, in the last stage, where the physical activities and the balance is completely lost, and the patient is forced to depend on, will be bound to wheelchair or bed. Now, what is the exact treatment for this? So, apart from the medications, if you focus on the lifestyle changes, then firstly, it will be get enough sleep. So, the patient has to be encouraged to have a very good quality of sleep, where he should be provided with good, pleasant, and peaceful ambience. Secondly, he should have a healthy diet. He should exercise regularly, as this disease is associated with physical movement, the muscular contractions, and the normal activities. So hence they should exercise so that it can smoothen the muscle movements. And then speech therapy, as they will be feeling difficulty in speaking something because of the vocal cord spasms, they should be encouraged to talk. They should be interactive so that they overcome the difficulty of the muscle spasm and try to speak something by their wish. And physical therapy of the patients who are in higher stages, they need physical assistance or the mechanical assistance by their family members or friends, which can also improve the severity of their symptoms. Now, coming to the different medications. So there are many anti-Parkinsonian drugs which have been approved for the treatment of the disease and which also show many results. So first, coming to levodopa, dopamine agonist, anticholinergics, antidin, catechol O-methyltransferase inhibitors, and monoamine oxidase inhibitors. So they have been shown good results for improving the symptoms and quality of life of the patient by majorly masking the abnormality of dopamine deficiency by increasing the dopamine levels. So now, how do you prevent? The people who are not suffering with Parkinson's disease, they want to prevent the disease in future. So the 5 ways to prevent the disease is firstly to avoid the exposure to pesticides and herbicides. If they are working in factories or industries, they should be completely protected from these harmful chemicals. And then they should eat a very good diet, that is fresh raw vegetables which contain folic acid, and fish which consist of omega fatty acids can help maintain the normal metabolism. And then vitamin D3, which can be obtained from sunlight, and animal fat, which can also maintain a very good health of brain. And then drink plenty of green tea. Green tea is very helpful, as many of the people will be using it as an antioxidant for obesity, weight loss, etc. Hence, we should also know, we should also understand that this also prevents and is very helpful in the prevention of Parkinson's disease as an antioxidant, as it majorly avoids the brain to respond to the inflammatory signals. And then finally, regular aerobic exercise can also strengthen the muscle movement and the physical activities. This was all about brief information of Parkinson's disease. Thank you so much for your cooperation, and let me say you that knowledge is only powerful if you share what you know. So share this as much as you can. So live your life healthy and live your life content. Goodbye.